Hello everybody and welcome back to my channel, or welcome to my channel if this is your first time here. I literally just had to restart this video because I was like a minute into it and I got a call from my doctors and I 100% came back to this video and had no idea what I had said. Not one clue. So I had to start the video over because I couldn't even remember exactly what I said at all. So this is my video from, I want to say it's like 27 weeks to 30. Tomorrow I will be 30 weeks. So, I put out all those videos at once where I like filmed all those videos, did my big update that was like 10 weeks long, and then I uploaded a bunch of other videos. So this one is only like a 2-week video, like it's only 2 weeks, which is pretty good. Sorry about the shaking. And I guess I have a lot to tell you. I mean, I'm gonna talk about some things that I had to have done, and then some different symptoms I've had, because I have noticed some different symptoms. Last Thursday I had a doctor's appointment at my doctor's, and I had to have my second glucose test for gestational diabetes, for like if you get diabetes while pregnant. I did my first one and I was fine. I ate the exact same thing before this time, which they said was fine last time, so nobody told me to fast, so I just ate the same thing. It was just egg whites and whole wheat bread, but I did eat different whole wheat bread and I did not like it. And then me and my husband actually checked it today, and it was like 3 times the amount of sugar and stuff in it, which is probably why I didn't like it, because it tasted sweet and gross. But I took that test, and I think they tested for my anemia again to see, or they tested to see where my iron levels were at, because last time I got tested, they found out that I was anemic. So I've been taking iron, which totally love. And I was waiting, because I did it on a Thursday, and I was hoping that the results would come back Friday. And I didn't get a call Friday, and then I was hoping I'd get a call Monday, but Monday was freaking Columbus Day, and I didn't get a call Monday, and I figured it was from that. So Tuesday, I was like, cool, I'll get a call Tuesday, because I had been told from my doctor, because I had been messaging her, that if I didn't get a call, that it was probably nothing bad and not to worry about it. I'd probably only get a call if it was like high. So I was like, oh cool, I did good. Even though this was like the big test I was worried about, because like nobody wants to have gestational diabetes right before the holidays. Like, come on. I don't eat a lot of sweets. I just want to say that I'm not a sweets person, but this was the first holiday I was going to let myself like indulge, because most holidays I'm always like, oh, I really want that, but I shouldn't. But this year, I had something to celebrate, so I was going to have a piece of pumpkin pie. I was going to have a Christmas cookie. Like, I cannot wait for those Christmas Oreos to come out. You know, the one with the gingerbread outside? I am living for those. Like, that's all I want. That's all I can wait for. Every time I go to the store, I'm checking for them. And I was so excited. So, I had been messaging my doctor, because I also got a shot Thursday for whooping cough, because apparently like baby can't get a shot for that till she's 3 months. So if I get a shot, then she gets the antibodies and she won't get whooping cough for the first 3 months, which I've never had a reaction like this, but my whooping cough like shot, I wonder if you guys can see it. It is like, oh no, it looks so much better today, thank God. It has been like this and red and itchy, like a healing itchy. So I messaged her to make sure everything was okay about that. And I asked her to like send me the results when she got the results, so I don't have to like worry. And I knew that like my test results were supposed to be under 140, because 140 is the cutoff for like diabetes and everything, or gestational diabetes, I think. Or at least that's what my test results said on my phone. So I was like, cool, I didn't get a call by Tuesday. I'm like, everything's chill. I don't need to worry. I was super happy. I was messaging my doctor already anyways about my, like the huge circle on my arm anyway, so I was already talking to my doctor. And she didn't say anything, so I didn't think anything of it. And then, backstory, if you've watched any of my other videos, you know I go to like the health department, which is where I go and I see my midwives, and I flippin' love them. They are angels from heaven. They are incredible. And then I see a specialist. I flipping hate my specialists. They are labeled in my phone as crappy doctors. I have one labeled good doctors, which is where my midwives are, and then crappy doctors, which is where my specialist is. So when I know when they call, I get excited for one call and I dread the other call. So it's Wednesday and it's like 2 in the afternoon and I get a call on my phone and it says crappy doctors and I'm like, why am I getting a call from the crappy doctors? They don't get my test results first. My doctor should get my test results first. So I pick up the phone and I'm like, hello? And they're like, hi, Kirsten. And it's the lady I don't like who, like, during our first meeting took 2 personal calls during our first encounter. And I was thinking about it yesterday and I was like, I don't think she's ever told me her name when we were in appointment square. I don't think she's ever told me her name. Or at least if she has, I don't remember. But she called, she's like, did you have any tests done? I was like, yeah, I had my gestational diabetes test on Thursday. She's like, did you get the results? I'm like, no, I've been waiting for the results. She's like, I have results. She's like, it's from this day. I'm like, yeah, I got the test on Thursday. She's like, oh, these must be the same results. She's like, you failed. Just straight out, you failed. I was like, oh, she's like, you got a 137. Mind you, needs to be under a 140. Just putting that out there. Sorry, my phone's going off. And so I was like, oh, okay. She's like, so we're going to have you do the 3 hours. I'm like, so I have to do the 3-hour test? She's like, yeah, we're going to have you do the 3-hour test. She's like, you also are anemic. I was like, well, yeah, we knew that. That's why I'm taking iron pills, because I'm anemic. She's like, yeah, but your iron levels, they haven't gone up much. And I'm like, okay, but I'm taking the pills. What do you want from me? Like, there's nothing, at that point, there's nothing else you can really do. She's like, well, I'm going to have you do this whole huge test to see what's going on with that. And I'm like, okay. She's like, I want to see if your B12 is low and yada, yada, yada. Now, if you've watched any of my other videos, you remember the only reason we found out I was anemic was because I asked to see if my B12 was low because before pregnancy, I had low B12. So we already tested to see if my B12 was low. Anyways. By the way, they had tested my B12, and my B12 was fine. She just didn't have those test results. She didn't know anything when she was talking to me. So, she's just this lovely, lovely person, who's super blunt, and she's like, I can tell you're upset. Take a breath. And I'm like, of course. And then she's like, I want you to do this at Quest. I'm like, well, I have an appointment next Thursday at my doctor's office. The good doctor, where I get all my blood tests. I'm like, can I get it done there? I don't know if they do the test there. Mind you, this is a specialist who has to work with the health department on a couple of patients a year. You have to think, you have to think there's a couple women who come in every year who, are high risk and have to go to a specialist. It's not like a specialist, it's just if you're high risk specialist. So I'm just like, so you don't know if these people that you work with all the time do this test. In all your years of doing this, you don't know if these people that you work with do this test. But she also wouldn't find out for me. She wasn't going to do any of the work. She's like, I'm just going to put you down for Quest. She's like, you can find out. You can call and find out if they do the test. I was like, okay, I will do that. No problem. So she's like, I'm just going to put you down a Quest. You can go any day. She didn't care when I got it done, as long as I got it done before my appointment with her on the 27th. Now, mind you, this all happened yesterday on the 15th, so that's like over 10 days difference. I'm just going to put that out there for a reference. So then, this is literally just a story time. This isn't even like an update. This is just a story time about how much I hate my specialist. So then, I messaged after I get off the phone with this woman, I'm like super frazzled and I'm like freaking out because this was a test I didn't want to fail. Even though, technically, I didn't fail it. Anyways, but since their cutoff is 30, which most places apparently are 130. Most places cutoff is 135, but their cutoff is 130, which is like, whatever, I understand, it's for baby. I'll do anything for baby. I'm not worried. It's just, it's a hassle, and she made me really stressed out about it when I don't think it was as big a thing as it should have been. I don't know. So I messaged my doctor right after I get off the phone with her, and I'm like, hey, I just found out my results. I'm like, if you call me, I swear I'll pick up. So I actually go for a walk with my husband because I was really frazzled, and I know going for a walk always makes me feel better. And he like talked me through. He's like, hey, I looked all this up, because he kept asking me. I was stressing out. And he asked me, he's like, well, what does gestational diabetes... Hold on, I have really bad acid. Oh, hello there, computer. But he was asking me questions like, what does gestational diabetes do to you or the baby? And I was like, I sort of knew, but I didn't 100% know. And he was asking me, I was kind of having a panic attack, so I may have started crying and told him to stop asking me questions. That's 100% what happened. I was literally bawling my eyes out in the bathroom on the toilet. So he's like, let's go for a walk. So we went for a walk, and he had looked up what it was, and he told me all the things. He's like, it's not that big a deal. Like, there are tons of people who get this, you know, after eating super healthy, which I went through everything that I've been eating, and I'm like, the only thing that could have possibly caused it would have been, like, white starch. So, like, bread. Because I never think, this is so stupid, I think of sugar as being sugar, but I don't think of white starch as turning into sugar, which was my bad, which I will totally think of differently now. But again, I'm not a super sweets person, so I thought, oh, this is going to be fine. I'm going to pass this with flying colors. Which, I mean, I'm still going to say I passed. I'm kind of pissed. I'm still going to say I passed. So we went on our walk. He really helped me calm down. He like talked to me. He's like, and he like told me all the things that he like had read. He's like, you know, it's not that big a deal. This is the only thing that could really happen. There's a chance it couldn't mean anything. This was just a screening. You know, we'll get you the test. It'll be fine. Da 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 da. And I was like, okay, I'll just stop eating white bread. Not a big deal. Like, I don't eat. Like, I guess I eat a lot of it, and I didn't notice, but, like, it's not something I have to have, because there's definitely been times in my life where I've cut out white bread altogether. It's just during the summer, I know that I have, sorry, I'm really hot, that I've eaten a lot more white bread than normal, so that was kind of on me, and I didn't think about that. I just didn't think about that as sugar. So my doctor calls me, like, right when I get home, and she's an angel. She's not even at work today, or yesterday. She was on call at a hospital, and whilst on the phone with me, this is why there's a difference between my doctors. The other lady couldn't even be bothered to find out if this company that she works with does a test, while my doctor is on call at a hospital working, calls me, tells me about the test, says, I'm going to get you in. I'm like, well, I come in Thursday. Should I just do it then? She's like, no, we want this done as soon as possible. Did you eat any sugar today? I'm like, I had a Sprite today. She's like, okay, I'm going to give you the weekend. I want you to be super healthy. Don't eat any white starch, any sugar. Monday, we'll have you take the test. And she's literally on the phone with me at the hospital sending in this report. So Monday I have an appointment. She also sends a report to the doctor who sucks about my blood test, because she's like, oh no, we already did that test. We know your B12 is fine. I'll send her all these answers. And then she's like, what else is she doing? She was doing something else for me too. She was answering all these different questions for me, sending in reports, finding out answers for me on all my shit, and then like telling me what to do and everything, when this woman couldn't even be bothered to do a thing for me. Like, this woman was at her office, at her desk, where she has all the information in front of her, can get anything she needs to, wouldn't lift a finger for me. Whereas my doctor, I love you. I love you so much, Candace. I swear to God, I love you so much, Candace. Was literally bending over backwards to help me, to get me an appointment, to make sure it was the right appointment, to make sure she could get me in as soon as possible, to tell me what to eat for the weekend, to make sure that it was good, to explain everything to me. Whereas this woman just called me, threw a bombshell at me, told me to take a breath, and then told me she wanted to do more tests as well, and then just, like, left. That's good doctor versus shitty doctor, I'm telling you. So, like, she got all this stuff done for me while on the phone with me, sent faxes to people, got information for me, set up an appointment for me, and I'm just like, and she made me feel better. Like, she literally, like, the other lady, I cried after I got on the phone with her. After I got off the phone with Candace, I was beaming. I was beaming. I was so happy. I felt so much better. She made me feel so much better. She explained it. She was so great. But like I said, I had just gotten a phone call from my doctor's office because I had sent in a message asking about, for Candace, asking about my test results. And, so they called me, they're like, hi. And it wasn't Candace, it was somebody else. They're like, I heard that you wanted your test results. I'm like, oh yeah. I'm like, I got my test results yesterday. She's like, from us? I'm like, no, not from you. I was like, from my shitty doctor. And she's like, honestly, you got a 137, which is passing for us. I'm like, yeah, but it's not passing for them. She's like, oh, so they're making you do the test? I'm like, yeah, I have an appointment Monday. So they're just like so nice, and like I have an appointment Monday, and then she even set up to do the other stupid blood test that the lady wanted about my anemia. She's like, you know, we already have all that information, but you know what, since we're already sticking you anyways, we'll just grab that too and then send it off to her. She's like, I also want you not to eat any of these things during the weekend. I was like, yeah, I know. And then I asked her, because I was like, I was looking for a snack, can I have popcorn? And she's like, I don't know if popcorn turns to sugar, because I thought popcorn turned to sugar, but she said she wasn't sure. So she's like, just don't eat it this weekend, and then on Monday you can eat as much as you want. I'm like, okay. So they were really nice. Even, like, you know, ones who aren't this person that I deal with personally are super nice. She told me what to do. She set up more blood tests for me to do on Monday. And it's just like, this is a privately funded, like, doctor's office versus a government-funded doctor's office. And the government-funded doctor's office, miles ahead in, like, customer service, and or I guess it's not customer service, would that be like bedside manner? I don't know. It's just, this video is just me complaining. Point is, I failed, sort of, my gestational diabetes test, and I have to have the big test come Monday, and I'm not eating anything white this weekend. I have, like, all my dinners planned out. We're having soup tonight. Tomorrow we're having a stir fry with brown rice and a ton of vegetables and tofu meat, actually. It's my favorite. And then Sunday I'm having a salad for dinner. And then I'm going for a walk. I have all this planned. So I'm just really, I'm, like, irritated. The whole thing was, like, I was more irritated than, like, upset. Like, I was scared because she didn't explain it to me properly, and I thought I was really bad off. And then she kept telling me, I was like, well, what should I eat? Should I just stop eating this? She's like, no, eat natural sugars. Eat a lot of fiber. And I was like, what? Why? She just kept telling me to eat a bunch of fiber. And I'm like, how is that going to help with sugar? She just kept telling me to eat a bunch of fiber. Which, maybe there's a correlation to that. I just don't know it. Besides that, other symptoms I've had, I literally walked out of my doctor's office Thursday after having the test. And I was telling her, I was like, I know a lot of people at this point are in a lot of pain and having, like, you know, lightning crotch and, like, their back hurts and stuff. And I'm like, I have none of that. Should I be worried? She's like, no, you're really lucky. I'm like, okay, awesome. I'm like, I just feel like I'm missing out on something. And I actually walked out of that doctor's office and didn't walk to a store, but I walked into a store. And it was like karma. Because I instantly got back pain. Like, this really bad, like, back pain. Like, she had moved and was, like, up against my back. And I was like, oh, this is what people are talking about when they say their back hurts. And it was just like a slap in the face. And ever since, walking hasn't, it hasn't, like, I don't want to say it hasn't hurt, because it's hurt, but, like, it's hurt a bit. And, like, when I lean over, like, especially when I'm on a cart and I go to lean forward to, like, give my back some relief, no, that hurts even more. So, I don't know what to do. That sucks. I'm gonna have to start, I keep always saying this, I'm gonna have to start wearing my belly band, but I think I'm definitely gonna have to start wearing my belly band soon, because, like, it's starting to hurt my back, and, like, some days are better than others. I don't know what it is. Some days are fine, some days suck. It's just, it is what it is. I'm trying to be optimistic, and because I made it this far without like really any pains. I will say one thing I have had that I don't know if it has to do with pregnancy is like the top of my leg when I'm walking hurts. It feels almost like if you ever had like your knee pop out, it feels like that, but like with like the top part of my leg, and it hurts. I don't know. I don't know if that's pregnancy related or just because I haven't been walking as much because it's been like hot and rainy here, which sucks. So, also sleeping. Sleeping has been weird. Like, I've tried so hard. I think I talked about this in my last video. I tried so hard to get myself on a good sleep schedule again, where instead of going to bed at like 1:30 in the morning, which is where I was sleeping, heads up, it's where I'm still sleeping. And I would like try to tire myself out during the day and not have a nap so I could go to sleep earlier, but like my body at night is like awake. It's so weird. Like, even yesterday, I was exhausted. And I literally ate my dinner super early, took my iron pill super early, and was able to get in bed by like 10. I woke up at midnight, could not fall back asleep till like 1:30, 1:45. So I slept for like an hour, 2 hours. Maybe I went to bed at 10, because it was like right when Rugrats came on. Whenever Rugrats came on, I fell asleep like right as Rugrats was coming on, and then I woke up like right as Rugrats was going off at midnight. And then I didn't fall back asleep until like 1:45. And then I had horrible dreams. I've been having like bad dreams lately. That's another thing. Like, and they're all about demons. Last night's was the worst though. I had a dream about a demon, and then I also want to apologize because the people are outside doing my lawn. But I had a dream about a demon, and like I was watching a documentary, which I have to stop watching documentaries on missing people and murders. Oh my god. But I was watching a documentary where I knew the outcome, like this little girl was gonna drown in a pool. Except that's not what happened at all. It's not what happened at all. There was like this demon that like, oh my god, I'm not even gonna go into it. It really fucked me up really bad. And then I tried to stay awake and watch something happy to like get my mind off of it, and it was really hard. And then eventually I fell back asleep like an hour later, and I had more demon dreams. Thank god not the same demon, but like, you know when you dream of something and you're like, I've been in this dream before, I know exactly what's gonna happen. This is a dream I've had before. I had one of those dreams about a demon, and I like knew it was gonna happen, and I woke up, and then I stayed awake for an hour petting my cat to like calm down and stuff, just because it was really hard to sleep. And then I fell asleep, and I had a dream that my diabetes like made my feet really big or something, even though again I don't have diabetes. I just like snowball effect of dreams. Like, you try to get out of them and like think of happy things and watch happy things, which is what I do. I put on happy cartoons, but sometimes your brain just goes back to that. And with pregnancy, you have those vivid dreams, and like, oh my god, everything's so vivid. It's horrible. It's so bad. So dreams have sucked. Heartburn has been regular, whether I'm eating or not eating. And I don't know if I talked about this in my last video, but if I roll over onto my right side to sleep, it's like it triggers heartburn. I literally roll over and acid just comes up my throat. I kid you not, that's a thing that happens. What else? I'm trying to think. Let's see. So we have heartburn. We have... Oh, I've started to get the restless legs. That was another thing I told my doctor. I was like, I haven't had this restless leg thing that people have. I have that now. Like less than a week later, I have the restless legs. Oh my god, last night it was so painful. It was so painful. Like, I don't know if people are having just restless legs or if they're having freaking Charlie horses. Like, I get Charlie horses in the middle of the night. I go to stretch my legs and it's just fucking Charlie horses all up the back of my leg. And it hurts so bad because these Charlie horses are the worst. Like, you get this Charlie horse and then you go to stretch it out to, like, get it to undo. No. It just puts another Charlie horse on top of your Charlie horse. It's horrible. It's horrible. And what else? I'm definitely nesting, which is great. I finally got, like, I'm getting baby's area set up, which is incredible. I'm really hot all the time. Like, all the time, I will get out of the shower and I will just sweat. Like, I try to take cold showers because if I take any type of hot shower, it raises my body temperature so, oh my god, this ass. It raises my body temperature so much. I can't cool down fast enough to fall asleep. Even though I fall asleep in front of 2 fans and an air conditioner. I cannot stay cool. Again, sorry if you can hear the lawnmower outside. But yeah, that sucks. Like, because like I already live in Florida, so it's hot, but I'm so hot, I like sweat through everything I'm wearing. I try not to wear like heavy clothes. I have this on because I don't like my arms showing during videos, and I was gonna wear a tank top and a sweater, and I was like, let's just do one. So I try to wear like tank tops as much as possible, just because otherwise I am sweating so much. It's supposed to get cooler this weekend, which I'm hoping for, because I was really excited to start wearing leggings for fall, and I can't because it's just so hot. Let's see, food. I'm not super hungry, but I'm not so hungry. Really weird. I don't know. It's really weird. I found out something I don't like. Apparently, I hate the smell of melted butter. Like, when you're cooking with butter, I don't like that smell. I thought we had, like, a spray for, like, one of those pan sprays that was, like, butter scented flavored. I don't know. And my husband used it, and it made me want to gag all the time. And I told him to stop using it. I had to get another one. And I really wanted pancakes the other night. And I asked him to cook them in butter because I wanted them to be crispy on the edges. And he put the butter down on the pan, and I thought I was going to throw up. So I don't think I like melted butter. That's like, it's really affected me. And I didn't like the way the pancakes tasted either. And I was really sad because I'd been craving them for days. And like, I definitely can tell that like my sense of smell and my sense of taste is changing a lot right now during pregnancy, which is interesting because I feel like that's something that happens in the beginning. But I didn't really have that too much. Ow. I didn't really have that too much in the beginning, so I think that's about it. I have, like, I'm going to the bathroom more. I feel like, oh my god, I feel baby constantly. When I went to the doctor's last Thursday, she checked for a baby's heart rate like she always does, but she had to go down below, she had to go down low to get baby's heartbeat, and she said, you know, to have baby's heartbeat be this low, I think baby's already in position. And I was like, oh, cool, because the other day, because when I had gone the week before to get a ultrasound, baby was up here. Baby's head was up high. You can't tell, but like up high. And I was like, that's cool, because since then, a baby has been doing some really big moves. She's like, yeah, that was her going down. She's like, I don't think she'll be moving back up again. I think she's getting ready for labor. And I'm like, that kind of scared me, just because I was at like 29 weeks. And I was just like, no, I was at 28 weeks. And I was just like, oh, wow, she's already ready. Like, that excites me. But, like, I'll be at 30 weeks tomorrow. And I just, the fact that she's ready and down there, I feel her so much more. Like, I feel her constantly. And I had to ask, because, like, I like to sit cross-legged no matter where. If I'm on my bed, if I'm on the couch, I sit cross-legged. It's comfortable for me. And I lean forward. And when I lean forward cross-legged, I feel her so much. And I had to ask if I was squishing her. And they're like, no. You're just, like, changing the amount of pressure in there. It's not like you're squishing her. It's just because there's less room, you feel her more. And I was like, okay, that's cool. But I feel her like crazy. Like, she is nonstop. It used to be like I would feel her like three different times a day. Like, in the morning, in the middle of the day, and then right when I was going to bed. I feel her, like, there's not 2 hours in between me feeling her, and she is constantly moving to the point where sometimes I don't even notice because I'm so used to it now. Like, I'll just feel her, and I won't even, like, consciously, like, feel it. Like, she's moving, and I know it, but I'm so used to it now, I don't consciously, like, acknowledge it, which is crazy. But she is just a moving, and I want to know what position she's in, because I can feel her at both sides sometimes, which is incredible. And then I also just, like, feel her just everywhere. She's just everywhere all the time, and it's incredible, and I feel her hiccup all the time. And I know a lot of people are like, oh no, my baby's really chill, I don't feel her that much. Baby girl is moving. If it's any acknowledgement of like how she's going to be when she comes out, she is just going to be moving and grooving. So feel baby, I feel her. It feels like, I tell my husband all the time, it literally feels like she's kicking me in the vagina all the time. Like she's kicking me in the vagina, which makes me have to pee all the time. So I'm so excited. I can't wait. This is just, I wanted to, like, I've been waiting for Halloween, but I'm ready for Halloween to be over now so we can get to Christmas. Because I want her so bad. Oh, hello. See, normally I wouldn't have acknowledged that if I hadn't just talked about her moving at both ends. It's crazy. Oh my god, I'm so excited. This has been such a long video. I am so sorry that most of this video was me just talking about the difference between a good doctor and a bad doctor. I'm gonna go now. I've talked enough, and I gotta go put up baby's like little bed area, and yeah, so ooh, excuse me, gross. I will see you guys in the next video, which hopefully will either be next week or the week after that, depending on how much like changes or what comes out of the test results. I'll probably do a video after I get my test results so I can tell you like if I actually passed or if I failed, because god, I don't want to fail. I don't think I'll fail because I'm literally cutting out all white carbs and like sugar, so like I don't think I'll fail, but if I do, I'm gonna be bloody pissed. Like and I'm gonna be stressed. More than anything, I'm gonna be stressed. I'm gonna cry thinking about it. We're gonna work our asses off and we're not gonna fail. We're just not gonna fail. So yeah, I have an appointment Monday, and then I probably won't make another video until at least next Saturday or something to give me the full week. So you might either get a video next week or the week after on the update. Depends on how much happens. A lot might happen. I might have a lot to say. So yeah. If you guys are pregnant as well at the same time as me, please let me know down below. I want to know when you're due if that's the case. And I just want to say thank you to the people who comment on all my videos and are so sweet. There's like 3 of you, and you know who you are, and just thank you so much. Like, it really means a lot to me. Like, this has been something that, you know, I've wanted for a long time, and like for it to be here and to be sharing with people and people to be like so positive, like, really makes me happy. So I just want to say thank you to all of you, and thank you for sticking around for such a long blobbery video. Okay, anyways, I will talk to you guys next time. Bye!